How are you? I'm fine, thanks. How are you doing?
I'm good, thank you. Can you introduce yourself to my followers? We're live right
Yeah,
now.
sure. Hi, so I'm Dr. Mayus and I'm a clinical psychologist. I'm currently on Instagram on my page at Dr. Mayus, and I'm just talking about therapeutic ideas that we can use in our everyday lives. So yeah, thanks for having me. It's nice to be on
Thank
here.
you so much. Thank you so much for being here and doing this for us. So, should we start with the questions?
Yeah, sure. What's the first one?
Okay, I have like listed few of them, so I'll start.
Ah,
Um, the
great.
first one says how to deal with loss of a loved ones.
Yeah. So I think with that one, just thinking about grief, I think the thing about grief is that it's very, very difficult. And it's also a really natural process that we all experience. So I think in societies at the moment, when we experience something that feels very distressing and, stressful like grief is, our immediate urge is to sort of get rid of it. And I think one of the things about being human is that we will have difficult times and difficult things will happen. I think the question was talking about how to kind of get over the loss
Y-
of a loved one
Yeah,
because it had really affected their family members.
yes,
And I guess the thing that came up for me was thinking that, different people grieve differently. So in some families, there'll be some people who seem to grieve a lot quicker than other people. Some people grieve very, very quietly, very, very privately. Some people grieve very publicly. It just really depends on the person. I think the only times to ever be worried about grief is if for any reason you start to feel like very emotionally distressed over a,
yes,
a long period of time. So if you start to notice that maybe feeling low has lasted for more than a year, then I might start being like, oh, okay, is this depression now or something else, as opposed to like just the natural kind of grief. So that's what I would
right.
say. I think for the person that sort of wrote that question, it might not feel like a good enough answer, but I think unfortunately grief is one of those things that really drives home what it means to be human, in that we can't really escape from it. There's no coping strategies. I would say the best things are just sort of making sure you look after your basic needs. So eating well, sleeping well, staying hydrated, having regular sleep patterns, connecting with the people around you. So the other people in the family who are going through that grief process, if it feels helpful for everyone or for a few people, just connecting with them and talking about the person who's passed away. Like oftentimes, if we can connect with other people and support each other, that can make it easier to go through something difficult.
Yeah, also in 2020, it's like a year of grief. Everyone is grieving. People are losing their families due to COVID. So maybe this question might be
Exactly.
like many people could relate to this, I think.
Definitely, and I think you're so right. Like, grief isn't just about, when somebody passes away, although that
Yeah,
is, the way that we tend to think about it usually. It is also about losing like your routine, losing the way you thought your life would be, like just losing like your sense of reality, like whatever that means in these times. So
right.
yeah, I think you're right. We're all sort of having different expressions of grief at
The
different
grief,
times at the
yeah,
moment.
yeah.
Mm.
We are all grieving at this moment, and we can say 2020 is like a year of grieving.
Yeah, exactly.
So should